Hi, I'm Kelly from North Shore Eye Care. Today I am sitting with Dr. Lawrence Zweibel. He is one of our ophthalmologists and surgeons here at North Shore. And I'm going to ask him a few questions and have a conversation with him a little bit about cataracts today, right?
All right.
How are you? Thank you for sitting with me.
Great, it's my pleasure.
Okay, so first thing I'd like to know, because we've never discussed this before, but I'm curious why you decided to become an ophthalmologist.
Well, to tell you the truth, I was always interested in sciences. When I was younger, I think I wanted to be an astronaut. But at some point, I realized that was never going to happen. And when I got into college, I took an interest in medicine. It was another science that I was interested in. And then going further, when I got into medical school, we had different rotations through different specialties. And ophthalmology really appealed to me. It was a specialty where in a relatively short period of time, you could do a lot of good for people.
Yeah, okay, good. So being that I'm a LASIK coordinator, I'm not specializing in working with cataract patients, so I have a few questions for you about that.
Sure.
I understand there are 3 types of cataracts. Can
Yes.
you please describe them?
Right. I think probably the best way to get into this is to first decide just what a cataract is.
Mm-hmm.
A lot of people don't really have a good concept. You really have 2 different lenses in your eye. The first lens is the cornea. We have a model of an eye here.
Okay.
And this one doesn't detach the side stuff. So this is the first lens in your eye. It's on the very front of your eye. It's the clear window of the eye. It's called the cornea,
Mm-hmm.
which is what a lot of people would consider the primary lens of the eye. And then you have a secondary lens in your eye, which lies behind the pupil of the eye. So this is a nice clear lens we have. When that lens gets cloudy, we call it a cataract. And as you mentioned, there are different types of cataracts. You could develop cortical cataracts. So this would be an example of a cortical cataract, where the cataract starts out in the periphery of the eye.
Mm-hmm.
And oftentimes people can do quite well with these, but they can cause some glare, especially as they move towards the center of the lens.
Okay.
We have another type of cataract which is common, especially in older people, which is the nuclear cataract.
Mm-hmm.
And in this case, it looks whitish, but usually it's a yellowish consistency. And people actually lose some of their color vision, so blues will tend to look black. And they're amazed when the cataracts come out how much sharper colors are and how much more vivid the blues are. Then they come on relatively slowly, but this is the type of cataract that comes on relatively quickly. You'll have people that weren't aware of a visual problem, and they'll come in with almost a sudden loss of vision. They don't know how it happened so fast. This is what we call a posterior subcapsular cataract, and it's very dense. And what happens with those cataracts is if they're a little bit off the line of sight, off the visual axis in other words, you won't even know you have a problem. And then all it has to do is move like a solar eclipse onto the visual axis, and people suddenly lose their vision. So this type of cataract occurs oftentimes in younger people, and again, it can occur rapidly.
Okay. I was going to ask you, I know some cataracts do affect younger people. What is the primary age range of a person that would have a cataract?
Well, nuclear cataracts, again, tend to be in older people.
Okay.
Cortical cataracts could be in younger people as well as older people. Posterior subcapsular cataracts also could be in older people, but more commonly we'll see it in relatively young people.
Okay. And what are some of the signs and symptoms of the cataract?
Well, people can do well with cataracts if they're not posterior subcapsular for quite some time. But the first thing that tends to go on people is night driving.
Okay.
They have trouble seeing things at night, and they also suffer from a lot of glare.
Okay.
The next thing I think that people will notice is difficulty reading. And one of the things that will go on people relatively early is if they're a golfer following a golf ball, especially if they have a nice long drive.
So like focusing?
Yeah, they can't see that little golf ball as it goes onto the horizon.
Okay. And how is a cataract diagnosed? Like, what are the testing that's done?
Well, certainly we could see it very well with what's called a slit lamp, which is really a biomicroscope. You can actually visualize the cataract. But just visualizing a cataract isn't enough. We only recommend cataract surgery if it's causing some sort of visual disability or even if a person's not complaining that much of the cataract, if their vision falls below what the motor vehicle requirements are, which is 20/40 vision,
Right.
you have to consider doing it under those circumstances.
Okay. I know with surgery there's different lens options for people. Do you mind explaining a little bit about those options?
Sure.
There's 3 of them, right?
Yes.
Okay.
There are basically 3 lens
Okay.
options. For someone who does LASIK, that's very good. So we say that there's a standard lens, which insurance fully covers.
Okay.
Now, the standard lens doesn't correct for astigmatism, and it only has a single focus to it. Usually, we'll try to give somebody a good distance focus with a single focus lens, but in a second eye, they might opt to have a little bit more near vision, sacrificing a little bit of distance vision, and that's called monovision.
Mm-hmm.
Now, if a person has a fair amount of astigmatism, we can get rid of that in 3 different ways. One way is to use a blade, which is seldom used. The second way is, which we can now reduce astigmatism, is with laser cataract surgery.
I was going to ask you about that. Okay.
So that gets rid of small to moderate amounts of astigmatism. And if the astigmatism is really large, there are excellent lenses called toric lenses, which can get rid of astigmatism. So a toric lens is the second basic type of lens that's available to people. And then the third type are lenses that enable people to see well both near and far. And of those, there are 2 basic types. There are accommodative lenses called the crystal lens, and there are multifocal lenses. And 2 different companies make those. These multifocals are quite good, causing very little in the way of symptoms. And that's our preferred way of helping people who want to see both near and far.
Okay. And I know the procedure is done as an outpatient procedure,
Yes.
so what is the recovery usually? And I also know 2 eyes have to be done at different times, right?
Right.
Can't be done at the same time. So what is the
Well,
recovery?
we find that the recovery is faster with the laser.
Okay.
The recovery in general could be anywhere. People can get reasonably good vision within a day to usually within a week. And again, some of the variables are whether they had it done with a laser,
Mm-hmm.
which is energy sparing in terms of the ultrasound energy used to get rid of the cataract.
It's more precise, right?
It's very precise, and so we like the laser. But another factor in terms of recovery is the age and how dense the cataract is. So older people with very dense cataracts are going to take a little bit longer to recover even with a laser.
Okay. Great. Anything else you want to add, or is that it?
No, I think that's
Very
great.
thorough. Okay. So if you would like to meet with Dr. Zweibel, we ask that you call our office at 631-265-8780. He'd be happy to schedule an appointment and give you a consultation. Thanks so much. And please follow us on YouTube and Facebook.